Stroke patients rejoice, a new frontier in therapy is here. Brief overview of stroke and its impact on patients. Stroke is a medical condition that occurs when blood flow to the brain is interrupted, causing brain cells to die. It is a leading cause of death and disability worldwide, with millions of people suffering from stroke each year. The impact of stroke on patients can be devastating, often resulting in long-term disability, cognitive impairment, and reduced quality of life. The importance of finding new therapies to help stroke patients recover. While there are currently therapies available for stroke patients, including physical and occupational therapy, medication, and surgery, these treatments have limitations and may not be effective for all patients. This highlights the importance of finding new and innovative therapies to help stroke patients recover and improve their outcomes. In recent years, there has been significant progress in the development of new therapies, offering hope to stroke patients and their families. Current therapies for stroke patients. Overview of current therapies including physical and occupational therapy, medication, and surgery. There are several current therapies available for stroke patients, including physical and occupational therapy, medication, and surgery. Physical and occupational therapy are often used to help patients recover from stroke-related disabilities, such as muscle weakness and impaired coordination. These therapies can also help patients regain independence and improve their quality of life. Medications, such as blood thinners and clot-busting drugs, are also commonly used to prevent and treat stroke. In some cases, surgery may be necessary to remove blood clots or repair damaged blood vessels. Limitations of current therapies and the need for new approaches. However, these current therapies have limitations. For example, physical and occupational therapy may not be effective for all patients, particularly those with severe disabilities. Medications may have side effects and are not always effective in preventing or treating stroke. Surgery is often invasive and may not be suitable for all patients. Therefore, there is a need for new approaches to stroke therapy that can provide more effective and personalized treatments for stroke patients. The new frontier in therapy for stroke patients. Explanation of the new therapy, including the use of stem cells and gene therapy. The new frontier in therapy for stroke patients involves the use of stem cells and gene therapy. Stem cells are undifferentiated cells that have the ability to develop into different cell types, and gene therapy involves the introduction or modification of genes in order to treat or prevent disease. Stem cell therapy for stroke involves the transplantation of stem cells into the brain in order to replace damaged brain cells and promote tissue regeneration. Studies have shown that stem cell therapy can improve motor function and reduce disability in stroke patients. Gene therapy for stroke involves the introduction or modification of genes in order to promote brain repair and regeneration. For example, researchers have developed gene therapies that can stimulate the growth of new blood vessels in the brain, which can help restore blood flow to damaged areas and promote healing. Benefits of the new therapy, including faster recovery times and improved outcomes. The benefits of these new therapies include faster recovery times and improved outcomes for stroke patients. Stem cell therapy and gene therapy can help promote tissue regeneration, reduce disability, and improve quality of life for stroke patients. Additionally, these therapies can be personalized to the individual patient, providing targeted and more effective treatments. While these new therapies are still in the early stages of development and require further research and testing, they offer promising new approaches to stroke therapy that could have a significant impact on the lives of stroke patients. Clinical trials and research. Explanation of ongoing clinical trials and research promising results from early trials and potential for widespread adoption in the future. There are ongoing clinical trials and research in the field of stem cell and gene therapy for stroke patients. These trials and research are focused on testing the safety and effectiveness of these therapies in human subjects. One example of a clinical trial is the STEMTRA trial, which is investigating the safety and efficacy of intravenous administration of human mesenchymal stem cells in stroke patients. Another example is the GAMES-RP trial, which is testing the safety and effectiveness of gene therapy for stroke patients by delivering a gene that promotes the growth of new blood vessels in the brain. Early trials have shown promising results, with some patients experiencing significant improvements in motor function and reduced disability following stem cell and gene therapy. For example, a study published in the Journal of Stroke and Cerebrovascular Diseases found that stem cell therapy improved the recovery of motor function in stroke patients, with patients showing improvement as early as 1 week after treatment. The potential for widespread adoption of these therapies in the future is significant, as they offer a new and innovative approach to stroke therapy that could improve outcomes and quality of life for patients. However, more research is needed to fully understand the safety and efficacy of these therapies and to develop personalized treatments that can be tailored to individual patients. Conclusion. Recap of the new therapy and its potential impact on stroke patients. In conclusion, the new frontier in therapy for stroke patients involves the use of stem cell and gene therapy, which offer promising new approaches to stroke therapy. These therapies have the potential to improve recovery times, reduce disability, and improve quality of life for stroke patients. Ongoing clinical trials and research have shown promising results, and there is significant potential for widespread adoption of these therapies in the future. Call to action for continued research and investment in new therapies for stroke and other neurological conditions. However, continued research and investment are necessary to fully understand the safety and efficacy of these therapies and to develop personalized treatments that can be tailored to individual patients. It is important for the medical community, governments, and private organizations to support and fund this research in order to improve outcomes for stroke patients and those suffering from other neurological conditions. Overall, the development of new and innovative therapies for stroke patients offers hope for those affected by this devastating condition, and it is vital that we continue to invest in research and development to bring these therapies to the forefront of clinical practice.